So I don't know if you guys remember, but when we were kids, right? There's one question that we always get. At least for me, I always get asked this, especially when you go for Raya events, when for weddings. The question is, what do you want to be when you grow up, right? And little me would usually answer, I want to be an inventor. That was my thing. I wanted to invent things. When I look at things, I think about like what it can become or how it can enhance somebody's life, and I wanted to become an inventor. For some people, they wanted to have crazy strength like Superman. For some, they want to dash like Flash. But fast forward to now, I'm 30 years old. I'm not an inventor, nor do I have crazy strength, nor do I dash from one place to another unless it's using the dash highway, which I don't use much of anyway. And at this age, what I realize is people in their 30s, right, especially, we're always talking about our growing responsibilities. Sometimes we talk to our friends about a financial setback, right? A financial setback or two. But what I realize is not a lot of people my age will admit that they have something like gout. So I kind of want to switch that up because I think what gout has become sort of a taboo subject, a taboo discussion. And I think in this episode, we want to eradicate that sentiment. We want to change that sentiment, right? My name's Afiq, and together on the Vital Sign podcast, we tackle some of life's most overlooked bodily mysteries. And today, we're going to be putting gout front and center. And to do that, to help us uncover this conversation, I introduce you Dr. Tan, who is a specialist in family medicine, right?
Hi, hello everyone. I'm Dr. Tan. Hi, Afiq. Thank you for having me here.
No problem. Thank you for being here. So, the first thing I want to bring up, right, is it feels like in this day and age, gout is something that's easily just brushed off. Is that true from your point of view?
I would say that gout is a common disease now. But talking about now, actually, this disease has been with us for a very, very long time. So what I mean long time, actually, it dates back like around 2000 BC, back into the Egypt's time. And the forefather...
Wow, Egypt, that's a long time.
Yeah. And the forefather of medicines, Hippocrates, actually classified gout as a unworkable disease.
For obvious reasons, I think.
Yeah, yes, because it affects the joint, right? It makes the people unable to work. And then back in the times where in the Middle Age times, the King Louis and also the King Henry VIII is also having this kind of disease. So can you see like there is some correlationship there?
Yeah, it seems like the high status people were the ones who were most susceptible to gout in the olden days.
You're very right, Afiq. So gout actually is a disease that the last time it differentiates between the have and the have not. So those who are eating much better compared to those who are not really having a lot of foods, that those who are eating much better is developing this disease.
Okay. So you're talking about like, when you watch Game of Thrones, you have like this scene where... Do you watch Game of Thrones?
Oh, yeah.
Yeah, so you have like the kings who have like a
feast. Yes.
So those people are more susceptible to gout because of the consumption
amount of
habits.
the food that they are having.
Okay.
But of course, this is not really the case in today's society. There are a lot of other reasons why someone is having gout.
But is that consumption habit one of the driving factors for it? On top of everything else?
There are many other factors that contribute, like why someone is getting the gout. So one of the things that we mentioned just now would be the diet factors, like what we have mentioned, where in the affluent society, you are taking a lot in meats, especially the red meats, drinking more alcohols, taking a lot of fructose-rich food and drinks. That would be one of the diet factors. But of course, there are genetic factors too. Okay, so in the genetic factors, they say that in gout, like about 5 to 15% actually is due to the genetic factors. That means you are born with that, you'll get a higher uric acid level.
So genetic factors... Okay, so genetic factors is different from it being hereditary, correct?
it is something like inheritance where you are more prone to having a high uric acid level. But like I say, it's only about 5 to 15%. A lot of other factors are actually more of the environments and also in the diet factors. And unfortunately, being a man actually make you more prone to having a gout.
That's great. That's great. So I'm coming from the point of view of someone who's not well educated with gout, because I don't have gout, but I do have family members who have gout. And I know the thing that I'm about to mention, it has nothing to do with this episode, but another hereditary disease that people are accustomed to is something like diabetes. If we were to put like diabetes and gout side by side, right? The percent, so it's the genetic factors for gout affects 5 to 15% of people. And how is that compared to something like diabetes? And this is just to give our listeners sort of a comparison with something that's more understood by the public.
For type 2 diabetes, we are talking about type 2 diabetes, they has a higher genetic predisposition compared to the gout. Yeah, so it's about 40 to 50%. So let's say
high.
if
Wow.
your parents have the diabetes, most likely the chances that you're having diabetes is higher.
Okay. So I mentioned earlier that, and the part of the reason why I brought up diabetes as a comparison to gout is because gout is a less understood illness, right? And I want to change that for people who are listening. So, doctor, I want to ask you, what actually is gout?
So when we're talking about gout, actually it's the inflammations of your joint. So the joint you are talking about, the most common one would be like the big toes, ankles, elbow, right? So what caused these inflammations actually is due to this higher uric acid level.
Okay.
So when you have a higher uric acid levels, this uric acid actually is a breakdown of our cell.
Okay.
So our body is constantly having this breakdown of the cell, remaking the cells, okay, part of our metabolisms. So it is actually a natural process that we have this uric acid being breakdown from the cells and it get filtered out through the kidney. All right. But if you're having a lot of these breakdowns or you're having some problems with your kidney filtrations or you're genetically having more things to be breakdown of, then your uric acid level will go up. Right, it makes sense, right?
Yeah.
Okay.
Yeah.
So the uric acid will go out, and then when this uric acid, okay, will start to form a crystal, and these crystals will get deposited in the joint,
And that's what causes the pain.
and that is what the gout, the beginning of the gout. So it is like, it's like whole sorts of the chemistry kind of the things, right?
Yeah. I was an art stream student.
Oh, sure. So I bet you understand very nice.
I understand accounts and economics, but this is something that's very new to me, but also very interesting to me. So one of the things about gout, and I hear this a lot from my friends and my family members who have gout. So my dad has gout. So when you say genetic factors, that scares me a little bit. But when flare-ups happen, usually it happens like in the big toe or like in the but you mentioned that sometimes it affects the elbows. So this might sound like a silly question, but none of the people that I know that have gout have ever complained about pain in their elbow. Is this a reason is this a reflection of a higher percentage of gout affecting the toe, or is it just random?
Usually the commonest area that we see is the big toe or in the foot and the ankle. Usually, why it is, you might be asking, why is it focusing more on the foot or the extremities, we call it? That is actually because when you have a high uric acid level and it become crystallized, so this crystal, right, they will flow all the way through your bloodstreams. But when you go to the small vessels, which we call capillary, the blood flow will become slower. So when it is slower, it's easily for them to deposit it. So that is the reasons why it affects the toes, the ankles, and also the foot most of the time. So what I say like elbows actually is quite an uncommon sight, but we do see patients that comes with the elbow.
Okay. And I imagine as gout progresses, it progresses in phases like a lot of illnesses. True. What are the phases of gout that people should understand?
Yeah, I'm glad you talk about this one. All right, because a lot of people will be thinking gout is just
As a one and done deal, right?
Yes, it's just like, okay, I just have to suffer for 3-4 days. That's it. I'm back to myself.
Yeah, that's some people I know because they're really stubborn people. Somehow, people who have gout are the most stubborn people you know.
I wouldn't say that they are stubborn, but I will agree that they might not to know the implications behind it.
So it's just that they know less about it, which doesn't allow them to make the right decisions around managing it, right?
Yeah, so we have to know actually this gout is a whole lifetime events that presented in stages. So if you have actually the event itself, it started even before you have the gout flare. It started when you have a high uric acid level. And you can just know that whether your uric acid level is high or not by just doing a simple blood test. That's it. You just go and do a blood test to test for your uric acid, and it will show the result that whether you have a high uric acid or is normal uric acid level. So that is the first stage. But a lot of people are what we call asymptomatic. That means they don't have any symptoms at that time of when they are having a hyperuricemia, what we call the stage of hyperuricemia.
Hyperuricemia.
Yes, hyperuricemia, meaning that you have a high uric acid level. Okay, so and then it will slowly progress. Maybe it's like 5 years later or 10 years later that they will have their first gout flare. Yeah. It depends. Somebody will have it very soon, 1 or 2 years later. So it depends on how is your diet and your uric acid level, of course. Right. And then when you have the gout flare, that is the time where you have a swollen toes. It will be very painful to touch. You won't even able to step down. Yeah, that is the time where the gout flare. Okay. So after 3-4 days of this kind of the acute pain, it subsides. So a lot of people might just forget about that.
Yeah, so that's interesting, right? So a change in perspective that I'm understanding from what you just said is for a lot of people who have gout, I think, well, I mean, I'm coming from the person who doesn't have gout, so you may correct me if I'm wrong, but it feels like when there's a flare-up, the concept is, okay, I have gout. When the flare-up subsides, I don't have gout anymore. But in reality, they have gout the whole entire time.
Yes.
But it flares up and then it subsides. But you still have gout, which means the things you do to manage that still need to prolong and still need to continue.
I totally agree with you. Yes, that is how it should be viewed as. In between, when they don't have the gout flare, they thought I'm totally good. So they didn't bother to take care of the questions of their. In fact, they are having gout and having a high uric acid.
Yeah, then they go and makan the fatty crab.
Yeah, same thing that are going to repeat it. And until the next episode, then it reminds them again that, oh yeah, I'm having gout. Yeah, so this in between this episode we call the intercritical times. All right, will be the sort of the honeymoon time where they will enjoy their life, they continue to our own lifestyles that without realizing that actually they have the gout. And until the next episode you come. And you will find that some of the patients, the intercritical phase where what we call a rest kind of periods is getting shorter and shorter. So maybe
the flare-ups are happening more often.
More and more frequent, yes. So instead of resting for about half a year only, you have the second episode. Like one of my patients, he's having it like almost 2 weeks will come once and 2 weeks will come once. Yes, that is how frequent it could be. And slowly, you will progress to what we call a chronic gout. Where in this phase, the pain will be quite constant. They are constantly having this kind of the gout flare, and they will develop something what we call tophi.
Tophi?
Yep.
How do I spell that?
Tophi.
Okay, and what does that mean?
This tophi actually is a yellowish, whitish kind of nodules. That is the depositions of this crystal, the high uric acid crystal that is in the joint. So it can appear in the joint or it appear in the skins or any bursa.
So it's visible on the top layer of the skin?
It will be visible at your toes, sometimes in the elbows we see, sometimes in the ankle we see. And it's not only visible or it is only in the skin, the outer surface. Actually, this tophi will eat into and erode into the joint. And it can damage the joint permanently.
And this is when the case of gout is severe.
Yeah. That time, I would say that we call the late stage of the gout already. Yeah.
The question that this is leading me to, right, is we now know that gout exists in phases. And then the later phases, as it progresses, is more severe, leading to something called chronic gout instead of acute gout, right? What I do want to bring up and what I think is important is what we've learned about illnesses is that most things usually tell you about something else that's happening with your body. An example of that would be if you have like a cold, it might be a symptom for something else. If you have a headache, it might be a symptom for something else. Does gout live within that same space? Does gout or high uric acid lead to something else that may be more dangerous to you and requires more immediate life-saving remedies or therapies?
Oh, I'm glad you asked these questions because we always say that when there is a smoke, you know there is a fire,
Yes,
right?
correct.
Yeah. So gout actually is like a smoke to say that actually your body is under a lot of inflammations process. So this gout, when a lot of research and literature has shown that gout is very associated with a lot of disease like the cardiovascular disease. It can cause the cardiovascular disease, which is like heart problems. You see, so why it is causing a lot of heart problems? Because gout itself is an inflammatory process, and this oxidative kind of stress, right, is putting the extra stress on all the blood vessels, and it includes the blood vessels in the heart. So that is the reasons for the cardiovascular disease.
So we've mentioned some causes, well, not really causes, but things that lead to gout, right? Genetic factors, diet. Is there anything more than that that can lead to someone getting gout, like something in the environment or something in their lifestyle?
So besides the genetic and the diet we talk about, it's like the gender I mentioned just now.
Yeah,
Men will be more prone to gout because why? Is because as women, we do have a hormone we call estrogens. And this estrogen will help us to flush out the extra uric acid. So we are protected until menopause. So that's why you can see there is a rise of the gout patients after the menopause. Yeah, in the female patients. So that is the hormone protections. And there are some other conditions that can lead to gout, like dehydrations. We are not drinking enough water. And some medications, all right, okay, some diuretics, it could be one of the causes also that leading to the gout.
So, doctor, I want to bring it back to something I said earlier, which is we recognize that gout is a long-term thing, and once you have it, it's there to stay. Just because you don't have flare-ups doesn't mean you don't have gout, right? And then, in order to find out whether you have gout, there is a blood test available, a relatively simple blood test that, correct me if I'm wrong, checks for levels of uric acid.
Yeah, that is very right, Afiq. Right? Yeah.
I remember this because you mentioned it earlier. But my question is, if the blood test checks for higher levels of uric acid, if that is the reading, does that automatically mean you have gout if you've never had a flare-up?
No, that doesn't mean it. So that is a few concepts that people mess up when they thought that when you have a high uric acid level, it's automatically to declare that, oh, you are the gout patient. That is actually not so. When you have a high uric acid level, you can be no symptoms at all. So that is what we call asymptomatic patients. But having a higher and higher uric acid level, of course, it will make you more prone to having gout in the future.
Okay. So at the very least, knowing you have higher uric acid levels means that there's a change that needs to happen in your life, whether it's your diet, your lifestyle. It doesn't mean that, oh, I don't have gout because there's no flare-up, I can go back to doing whatever I want to do, because that uric acid level is going to go up and up and up and up.
Correct. So that is why you are having a blood test and get a high uric acid level. That will be the point that where you start to intervene, whether to change your lifestyles or to take care of your lifestyle and all these things before you get the gout. We don't want the pain, right?
Yeah. I also wanted to bring up something that we may have brought up earlier, but I don't think we went deep enough, is there is a strong connection between high uric acid levels and stuff like cardiovascular disease, right?
True. Some heart problems, yes.
Can you help us dive deeper into like what that is?
So there is a lot of studies to show that gout actually is interrelated with a lot more other diseases. So besides the heart problems that we're talking just now, it can also cause kidney problems. So it makes sense, right? Because it is being filtered through the kidney, the uric acid. So if your kidney need to work harder and harder to filter out the more and more uric acid, eventually they will be like overwork. And this uric acid will get deposited in the kidney and form the kidney stone. So the kidney stones is always related with a high uric acid levels.
Okay, so kidney stones are like, having kidney stones is also signs of high uric acid levels.
Yeah, true.
And what about metabolic syndromes?
Another studies also show that it has actually associated with the metabolic syndrome. It is not one disease itself, but metabolic syndrome is like more of you have a high cholesterol level, high blood pressures, and these are all one whole set, and obesity, and this is like one whole set of these syndromes that to more prone to you to having a diabetes, hypertension, and all this in the future.
So I think what it sounds like is the best thing to do is to go see a doctor when you feel like there's something wrong with you. But what I'm imagining, right, is so we know there's blood tests, and this is coming from let's say I'm a layman, right? And I wake up one day, I feel nothing. What what is actually going to drive me towards taking that blood test in the first place? That's where my gap in knowledge exists. How do I begin to even know that there is something wrong with me if there's no flare up, and if I'm asymptomatic?
Yeah, so that is why I want to advise, even before you get the flare up, before you get the pain, you have to do your body checkup. There will be like a yearly kind of the blood test, a simple blood test, body checkup for yearly, that you can just add on the uric acid as one of the indicators or biomarkers in your blood test.
So remember, do your medical checkups, right? Your medical checkups are
and
important.
add the uric acid level inside.
That's something I have to do. I've also heard that high uric acid levels have a link to other metabolic syndromes, right? But what are metabolic syndromes? Because I say it like I know what it is, but I would love for you to explain to me what metabolic syndromes are and how do they actually link.
So this metabolic syndrome is not just one single disease, but it will be like a cluster of other diseases. So it include like hypercholesterol, cholesterol is high, blood pressure is high, hypertensions, and also overweight. Yeah, so this is like a whole clusters of the disease that we group together to say that this is a metabolic syndrome.
Okay. So we've talked about, so far, what stands out to me is hyperuricemia. We talked about high uric acid levels, and we've talked about gout. What this conversation has led me to understand is these three things are linked, but they're not one and the same thing. And I think that's really important to understand. And the point that I also want to make to the listeners, right, is just because you have high uric acid levels and no pain, no flare-ups, no symptoms of gout, doesn't mean that you're okay.
Yeah, don't ignore it.
It's a window to the fact that it may lead you to other things that are going to make your life less than comfortable.
Exactly.
So it is better for you to purposely make your life less comfortable for the greater good of your body, right? Like change your lifestyle, change your diet when you know you have high uric acid levels. So that, number one, it doesn't lead to the point where you have gout. And number two, even if gout is not where it leads, it doesn't lead to other things like cardiovascular disease, like the other metabolic syndromes that you mentioned. Yeah. I think that's a really, really important message for people to sort of understand whether or not you have gout.
Yeah, agree with you 100%.
So after everything that we've talked about today, right, I think one of the important things for our listeners to know is to always go for the medical checkups, yearly medical checkups. And once you do the medical checkup and you go see a doctor, remember to listen to your doctor, right? So speaking about listening to doctors, you're a doctor yourself, obviously. Is there anything that you think our listeners need to hear?
Yeah, so first of all, get your blood test done. Add in the uric acid as one of the biomarker. Okay, know your uric acid level. Okay, if this is really skyrocket high, get it under control because this is really necessary even before you have your gout attack.
Awesome. And that actually leads us perfectly to what the next episode is going to be. So stay tuned next week, because next week is when we're going to talk about how we're going to live with and manage our life with gout. Before we close the episode off, I want to bring up a question from one of our listeners that I think is a highlight for and a representation of how a lot of younger people think. Right? So I'll read the question out for you. It says, "Hello. Can I just say that I'm so glad this podcast is being made? I'm a young guy in my early 30s and I have gout. But no one knows I do because I'm pretty sure they'd judge me. The thing is, I'm pretty sure my family knows something is off because I've had to make pretty severe lifestyle modifications, which means I'm always saying no to family and friends who want to grab a drink or have a big seafood dinner. How can I go about telling them?" This question stood out to me because as I mentioned earlier, I know a lot of people who have gout, and some of them, when there are flare-ups, they try to keep it as hidden as possible. And I did use the word taboo much earlier in the episode, but I realize now I don't think it's a taboo thing. I think it's more of the younger people who have gout feel like they shouldn't be having it and feel like it is maybe a reflection of their habits, which embarrasses them. What would you say to a question like this?
I think I can relate it to his pain. That I do have a lot of young patients, and in fact, I would say that my patients is getting younger and younger for gout. And there is not much of data in Malaysia, but in UK, it shows that for those around 20 to 30, suffering from gout has increased 3-4 throughout the years. So we can see that actually this disease is quite common, especially among the younger populations. But I know how they feel. Is like they say they are so young, they are not supposed to succumb to a sick role kind of the things. Yeah. But what I want to say to this listener is this is the time for you to make a change because there are many good years yet to come. So this is the time for you to make a change in your lifestyles that you will have a better years to come.
I think, yeah. So it's important to get out of that the idea of like gout being an old man disease, because that's old news, and get into the fact that everybody can get gout.
Yeah, in
Young
fact, maybe
or
he
old.
will want to talk to his friends and other colleagues and find out maybe a lot of
Maybe
people
some
are
of them,
getting
maybe
it.
some of them have that. Maybe they can have a
Yes.
whole community and talk about it. First of all, thank you so much for joining us for this first
Thank you,
episode.
Afiq.
I feel like I was back in the classroom. I'm lying because I was an art stream student, as I've mentioned. I didn't learn science.
I hope I didn't bore you. With
No,
that.
you didn't bore me. So the thing about me is I love learning new things, and I feel like I've learned a lot in this episode alone, which makes me really excited
Good to hear that.
for the next episode. And you didn't overwhelm me, is what I'm trying to say. You didn't overwhelm me, and I'm actually glad that we had this conversation. And there's a lot more that I understand about gout now, and I can help my family and friends who have gout, and I can better understand them. I can also make sure they don't eat certain things and keep track of their habits if they want me to, and that, that all the little things that we can help, I think goes a long way.
Yep, true.
But I do want to bring attention to the fact that next week's episode is going to be amazing. We're going to talk about gout and how we're going to face gout head on. If you have gout, how we're going to manage it, and how to live with gout to ensure that the quality of your life is not affected by your situation, because everybody deserves to have a good life no matter what they go through. And with that, I have been your host, Afiq Kamarudin, and this has been the Vital Sign Podcast. I'll see you guys next week. This podcast is a production of Renegade Radio with support from Abbott Malaysia. It was produced by senior producer Kelvin and producer Raghinie Ravi. Written by Alyssa, Pong, and Arnaldan Bryan Henry, who also edited the series. Fact-checked by the Abbott Medical Affairs team. And once again, I have been your host, Afiq Kamarudin. Catch you next time on the Vital Sign Podcast.